Philippine Senate Bill 3195, Advanced Directive Educations Act, an act directing the Secretary of Health to develop and implement a national public education campaign on the importance of advanced care planning and of the individual's right to direct and participate in his or her healthcare decisions. Section 1. This law shall be known as the Advanced Directives Education Act. Section 3. National Public Education Campaign. Content of educational campaign consists of the following: employ the use of various media, provide culturally and linguistically appropriate information, conducted continuously over a period of not less than 5 years, identify and promote advanced care planning information available on the DOH, raise public awareness of the consequences that may result if an individual is no longer able to express or communicate their healthcare decisions, address the importance of individuals speaking to family members, healthcare proxies, and healthcare providers, address the need for individuals to obtain readily available legal documents that express their healthcare decisions through advance directives, raise public awareness regarding availability of hospice and palliative care, encourage individuals to speak with their physicians about their opinions and intentions for end-of-life care. Do not resuscitate or do not intubate. No court order is a written order to do nothing if certain situation arises. Most commonly, a do not resuscitate or DNR order means to no longer perform cardiopulmonary resuscitation or CPR to patients who are undergoing cardiopulmonary arrest is a policy in all hospitals. CPR is a series of measures provided to prevent death when a sudden collapse occurs because the heart stops. Reasons for issuing DNR includes the following: when resuscitation is not medically indicated, more harm than good will be done by treatment or resuscitation, when there is no further therapy for the underlying disease of a terminally ill patient, or the patient expresses that resuscitation should not be attempted. Each of the codes needs separate considerations. Slow code or show code considers verbal orders to the staff to respond slowly to a cardiac arrest, used to give the appearance of resuscitating, especially to the family, gives the impression that everything is being done to save the patient when the family insists that the patient be kept alive despite brain death. Problems: deception involved should be considered unethical. No written order is involved, so there is a refusal to take public responsibility. For partial code, it considers written order to omit some medical interventions but to employ others. Example: attempt chest compression but omit intubation. And reason should be written on the chart. Living will is only followed in the event that the patient is diagnosed to have terminal condition or unconscious situation by two doctors. A living document that allows a person to state whether he or she wants his life or her life to be artificially prolonged in certain conditions. What types of treatment should be administered in specific situations? A. Can contain the name of someone to make such choices for you if you are not able to do so. And B. One has the option to review and revise your advanced directives as needed. Healthcare directives: informed consent. Informed consent shall be obtained from a patient concerned if he is of legal age and of sound mind. An exception is when the patients are incapacitated and a third-party consent is required. When making a decision about withdrawing treatment from incapacitated patients, rarely do physicians arrogate the task unto themselves. They usually consult the patient's next of kin, since it is required under law for any decision-making involving an incapacitated person. Healthcare directives: end-of-life decisions. Some medical conditions permit the extension of life for many years through artificial means, but many patients and their families question the value of doing so where there is little hope of recovery. The quality of life during and after recovery from an illness is often an important issue. Consider quality of life issues in making decisions about accepting, rejecting, or stopping medical treatment. The patient may ask these questions to him or herself. If a terminally ill or permanently unconscious, would you wish to have your heart restarted if it stops? How much medical treatment do you wish to have if you develop a terminal condition or permanently unconscious? And who should make decisions for you if you're not able to express your wishes? The physician's initiative includes to discuss termination of care for the patient, and to inform the patient clearly and completely about his condition in order to obtain consent for treatment. This should include an accurate description of the burdens and benefits of continued treatment and the odds of success. It also means the physician must tell the patient when it is likely that the patient will die no matter what is done. Essentially, in advanced directives, the doctor and the hospital would like to respect the patient's wishes, but they need to know first what the patient's wishes are. Advanced directive is based on the principle that adults have the right to control their medical treatment as long as they are mentally able to do so. It is a legal document that allows people to communicate their decisions about medical care to family members, friends, and healthcare professionals in the event that they are unable to make those decisions themselves. For example, due to being unconscious or in a coma. Two main types of advanced directives is living will and medical power of attorney. DNR and DNI, written by a licensed physician in consultation with the patient or surrogate decision maker, that indicates patient will not receive cardiopulmonary resuscitation in the setting of cardiac and/or respiratory arrest. Patients can ask these medical decisions to their physicians: cardiopulmonary resuscitation or CPR, mechanical ventilation, tube feeding, dialysis, antibiotics or antiviral medications, comfort care or palliative care, organ and tissue donations for transplantation, and donating your body. A bill filed in the 16th Congress, Senate Bill 1887 entitled Natural Death Act, sought to discuss the fundamental right of the adult persons to decide for their own health care, including the decision to have life-sustaining treatments to be withheld or withdrawn in instances of a terminal condition or permanent unconscious condition. It also states that in order to protect the patient's individual autonomy and to recognize its dignity and privacy, our law should recognize the right of an adult person to make a written directive instructing such person's physician to withhold or withdraw life-sustaining treatment in the event of a terminal condition or permanent unconscious condition. A person's right to control his or her health care may be exercised by an authorized representative who validly holds the person durable of power of attorney for health care. It's never easy to make final decision on end-of-life medical care, no matter by patients, their families, or by the healthcare team. End-of-life care sometimes arouse emotion and conflicts between healthcare providers and patients' significant others. If patient wishes or decisions were not clear, conflicts would arise between the families and the healthcare team for proceeding or forgoing the life-sustaining treatment. Hence, a clear documentation on patient's preference and determination of the final decision about receiving or forgoing medical intervention is crucial and essential. Healthcare to the dying patient. The goal is to prevent and relieve suffering of all types: physical, psychological, social, and spiritual. First, prevention of and relief of pain or other physical suffering. The list of medicines is based on the 2015 WHO Model List of Essential Medicines for Palliative Care for Adults and Children. Those medicines shall be used for, but not limited to, the following symptoms: agitation, anorexia, anxiety, constipation, diarrhea, dyspnea, fatigue, insomnia, delirium, depression, nausea and vomiting, pain, and respiratory tract secretions. Second, prevention and relief of psychosocial and spiritual suffering, comprehensive psychosocial and spiritual assessment, therapeutic communication through facilitated discussions. Patients capable of preparing a simple legacy for their children or other family members, such as a letter or memory box, should be given this opportunity, and provide culturally appropriate spiritual support.